Heart failure / congestive heart failure, CHF. Understanding the silent menace. Heart failure meaning. Heart failure is a combination of two words. The term heart is derived from Old English "heort," which means a hollow muscular organ that circulates blood. The term failure is derived from the Anglo-French word failure, which means the act of failing. It is also derived from Old French failure, which means to be lacking, or not succeed. Heart failure is a complex clinical syndrome that occurs when the heart is unable to pump sufficient blood to meet the metabolic demands of the body, or can do so only at elevated filling pressures.
It is a chronic, progressive condition where the heart muscle is unable to pump blood effectively to meet the body's requirements. As the heart's pumping power diminishes, it can no longer supply the body with enough blood and oxygen, leading to various health complications. Heart failure, HF, sometimes known as congestive heart failure, CHF, is a medical condition that results from any structural or functional impairment of ventricular filling or ejection of blood. The primary consequence is an insufficiency in the heart's ability to pump blood through the body, leading to a backup of blood and fluid in the lungs, abdomen, liver, and lower extremities.
Heart failure is the inability of the heart to maintain adequate cardiac output to meet the metabolic needs of the body because of impaired pumping ability.
Diminished cardiac output results in inadequate peripheral tissue perfusion. In heart failure, there is an increase in preload, increase in afterload, decreased myocardial contractility. Cardiac output, CO, equals stroke volume, SV, x heart rate, HR. SV determined by preload, afterload, myocardial contractility.
It is not a disease in itself but a result of various structural or functional cardiac disorders that impair ventricular filling or ejection of blood. In heart failure, the heart's ability to pump blood efficiently is compromised. This can lead to 1. Increased preload. Preload refers to the amount of blood in the ventricles at the end of diastole, relaxation. In heart failure, the heart may not pump efficiently, leading to increased blood volume in the ventricles, which increases preload. 2. Increased afterload. Afterload refers to the resistance the heart must overcome to pump blood into the circulation. In heart failure, the heart may need to work harder to pump blood, increasing afterload. 3. Decreased myocardial contractility. Myocardial contractility refers to the heart muscle's ability to contract and pump blood. In heart failure, the heart muscle's contractility is often decreased, making it harder for the heart to pump blood effectively. Cardiac output, CO. Cardiac output is the amount of blood pumped by the heart per minute. It's calculated as CO equals stroke volume, SV, x heart rate, HR. Stroke volume, SV. Stroke volume is the amount of blood pumped by the heart with each beat. It's determined by 1. Preload, the amount of blood in the ventricles before contraction. 2. Afterload, the resistance the heart must overcome to pump